Alright, today we are going to perform maintenance and clean our Catalyst DX machine. So we're going to start by opening it up. We're going to make sure that everything is working properly, nothing looks broken, that everything is clean. And we're going to wipe down the inside of this with lens paper and alcohol wipes.
Yes.
And we'll do this 3 times. We're missing the glass circle pieces in here first. We will clean those separately, doing the same thing, alternating wiping it 3 times with alcohol and lens paper. We'll make sure everything else looks clean, nothing looks damaged on the inside of here. And then we will put all of our pieces back. And now it's starting to initialize. I empty the waste store on this side. I'll also make sure there are tips in here. It'll ask if the waste jar is empty. I said yes. Now I'm going to come to my screen over here. And I'm going to go to Instruments. I'm going to go to my Catalyst DX because that's the one we're using. I'm going to press Quality Control.
Okay.
I'm going to match it up with the expiration date on here. And I'm going to press Run Quality Control. Now it should come over back to this screen. We'll run it like our blood work. I'm going to take 3 mils of my dilute and put it into the control vial.
Yeah, certainly. I'm not going to put you on a little more right, hold it out and get up next to it. Okay? Thanks. This is mine.
Now I'm going to gently invert this to mix it. Alright. Once it is thoroughly mixed, I can pull the top off of here. And I'm going to pull out 300 microliters using my pipette. And place it into one of our cups here. Now I'm going to load the cup in, as well as our clips. We're going to run a light 4 with our quality controls. So I'm going to put the light 4s in. So if we have it there. quality control clips, and these have handles that pop right out. You can place the clips in, and you pull this right off. The clips are all loaded. I'll press run.
Did you have Scout 1 week revisit? Are we revisiting the incision site?
And we're gonna let that run process this. And now we can look at the results of our quality controls by viewing them on here. And see everything. Alright, today I'm going to show you how to run an ELISA test. We're going to do an FELV, FIV snap test, and the FIV is the ELISA part of this. You can run it on either blood or serum. So we're going to do serum because it's a little more accurate. So I'm going to take my already centrifuge blood and get the serum off the top of it. Here, I'm going to take 3 drops of the serum and place it into this micro tube. And then I'm going to take the control here that they give you. You're going to do 4 drops of that. I'm going to gently invert the tube about 4 to 5 times. And you place it in the little well here of our snap test. Now, the amount of time that you want to give is going to be 10 minutes from when the liquid here reaches this little circle, and you'll snap the test and then incubate it for 10 minutes. We have these fancy machines called the Snap Pros that do it here for us. So I'm going to press our cat here that we're doing it on straight and place it into the snap test. And it's going to read it and snap it and time it for about 10 minutes for us. For a simple fecal flotation, we're going to take 2 to 5 grams of our feces, place it in a cup with 30 mils of sugar solution. We use Sheathers. I'm going to mix it in solution, and then I'm going to strain it using our metal strainer into another cup. And then we are going to place it into a conical tube here. Now I'm going to place a cover slide on top of it and let that sit for 10 to 25 minutes. When making a centrifugal flotation, I'm going to do the same thing as my simple float, then take our strained solution, pour it into a conical tube until it forms a meniscus over the top. And then I will place a glass cover slide over that. Since we're going to be centrifuging this, we need an opposite tube that's the same weight, so we're going to fill that with water until it forms a meniscus. And also place a glass cover slide on this.
Alright, midnight is in one. Yep. You can see Oh.
I'm then going to put them in a bucket centrifuge and centrifuge them for 5 minutes at about 1500 RPM.
He was hiding in the...
For a direct fecal smear, we're going to take our wooden applicator, place it directly in the feces, and we're going to take a drop of saline and place it on our microscope slide. There. Now I'm going to take this with a little bit of feces on it and smear it into our saline until you have a nice homogeneous mixture. You want it clear enough to be able to see a neat newspaper through. And now I'm going to want to place a slide cover on top of this, and it can be read. for a simple fecal flotation, we're going to take for fecal sediment, you're going to use 2 to 5 grams of feces, mix it with 30 mils of water, and let it sit for 30 minutes. Alright, now that it's sat for 15 to 30 minutes, we're going to take and decant the supernatant off of it. Saving just the sediment. Now we are going to resuspend this about 4 to 5 times. We're going to repeat this process by adding water.
Dr. Emily's just doing the puppy rooms today. I'm okay with that. Oh my gosh! So screwy. It's like, Christy, what you in? She was on the baby scale and she was just like wagging her tail and everything. I'm just like, oh my god.
And we're going to let it sit for another 15 to 30 minutes. Now I'm going to decant off
I can refill things if I know what
the rest of this and leave the sediment
or Kelsey's out of the bathroom and she can refill things.
undisturbed.
She needs. Okay, give her food. And one next part.
And now I'm going to mix the sediment with a pipette.
You doctors and you're still making it.
I'm going to place a little bit of that on a slide
What's her food?
with a cover slip.
I didn't do that to be fair.
And I'm going to repeat that procedure until all the sediment is gone. Alright, today I'm going to be showing you how to run blood chemistries. So we're just going to do the ALKP for Sloan here. I have serum that we've already spun down from our red top tube. This is our request here. These are the pending requests. This is for Sloan, this is for ALKP. I'm going to click on it and press run. It'll ask me which machine I'm going to do it on. We're going to do the IDEX Catalyst DX. I'll select that and press run again. And now we're going to come over to the catalyst here. Now I'm going to press select here. It's going to ask me what type we're running it on. I'm going to press serum. And press next on that. It's going to open up. It's already cut in there. I'm then going to place my serum in one of these little cups here. And place it in this little holder. Then I'm going to take my ALKP clip here. I'm going to open it up, clip, and I'm going to place this here in the machine with the black side up, just like that. Now I'm going to press run on this. To view the results of our blood work that we ran, it's going to be in the recent test results. I'm going to click on Sloan, and press view. And here is our results that came up. And we can print it from here, or it will show up online through IDEX and we can print it through a paper thing on there. This is how to get ear swabs for an ear cytology. So we're going to get a swab from each ear, making sure to get sample on your cotton tip swab, but not go too deep in the ear canal. For prepping an ear cytology, we're going to take the swabs that we just had here and place them on our slide, rolling them over, making sure that we get enough discharge. I'm going to label it with her name. And we're going to pass it under a flame to help get rid of the earwax. Now we've got our diff quick stains here. With these, we're going to dunk it into each stain 15 times. And then we're going to rinse it in the sink. And quickly dry it off. And it's ready to be read under the microscope. When evaluating the ear cytology under the microscope, you're going to use it at 100 power or the oil immersion lens. So you're going to place a drop of oil on the slide and look at it under the microscope. And on this, we saw nothing. She had a lot of yeast in her left ear and a little bit of yeast in her right ear last time, and this time it's just epithelial cells. And we would turn our microscope on, make sure our light and condenser is all working, and we would calibrate it using our macro and our micro fine tuners here. We're going to perform a necropsy on a cat here named Grace. We've got our masks, gloves, and gowns, as well as a scalpel and scalpel holder, and several biopsy jars, and a staple gun to close her up afterwards.
Okay, so we'll start with a brief external exam where we look at her eyes and ears and mouth and rectum. The only overt abnormalities we noticed on that is a large mass in her caudal right oral cavity, which was the reason that she was ultimately euthanized. Otherwise, no abnormalities on her external exam, so we'll go forward with her midline incision. I have to edit this first, so take a bit. As we make this incision, we look for any abnormal hemorrhage, knowing that there'll be some post-mortem changes. falciform fat. Since she's a cat, the ribs are thin enough that the scalpel is able to cut them. You can see that her diaphragm is intact as we separate her. So just on gross exam, we see some congestion in the lungs. It's likely post-mortem artifact. There are some possible nodules in part of the lungs, so that will likely be a good biopsy sample to take in case there's any metastatic lung disease from her tumor. We'll cut into her heart so we can assess the thickness of each chamber. There's a normal amount of clotted blood in her heart. The left ventricle of her heart is actually really thickened, so she probably had some occult heart disease, some hypertrophic cardiomyopathy. It may be worthwhile to take a biopsy sample of her heart as well. The left ventricle is very small with a thickened wall. Well, there's some spots of pallor in her liver. There's definitely some discrete areas that are different than others. So it would also be worthwhile to take a liver biopsy for potential metastatic disease. Her gallbladder looks normal. Her spleen is normal size, no abnormal nodules, hemorrhage, congestion there. Her kidneys are both relatively small. I think this cat probably had some degenerative kidney disease. If we run her intestines, I don't see anything that's perforated. The pallor in her intestines is likely normal post-mortem artifact. Small intact bladder. And we can see the rest of her pluck, including her esophagus and trachea, going up through her oral cavity. So before we take that out, we'll take biopsy samples of a few of her abnormalities for formalin jars. Do you want to cut part of that out, or do you want me to take it? I'm going to cut out part of the oral mass. Biopsy jar. Very friable tissue. biopsy of the liver nodules. We'll take a portion of liver, including both what looks like normal and abnormal tissue. And next we finish looking at her lymph nodes, adrenal glands, and finish removing the plaque from her oral cavity down to her thoracic cavity.
And here are our biopsy jars labeled with her name, the place they were taken from, and the date. For handling rabies suspects, only a licensed veterinarian and people who have been vaccinated against rabies are allowed to handle them. You are going to wear a gloves, mask, and preferably an apron to make sure that no potential rabies fluid can get on you, as well as you are going to take the euthanized animal and cut off their head. You want to keep it in a sealed, airtight, leak-proof container and refrigerate the head. The rest of the body can be frozen and then either sent for cremation or buried at least 4 feet under and covered with lime. That should be checked with your state guidelines because it may vary from state to state, as well as the head can either be contacted, your local authorities, and some of them may come pick it up from your clinic. You may have to hand deliver it or mail it, but it should definitely be in a leak-proof container and labeled properly that there may be infectious disease such as rabies in the container. Today I'm going to show you how to get a vaginal cytology. This is Sloan. First we're going to scrub the vagina. We have our scrub here. You're going to start in the middle and work your way out. And then the same thing with the alcohol next. We're going to repeat each of these 3 times. Next, I'm going to take my sterile cotton swab and moisten it with sterile saline.
Yeah. Okay. We'll wait right here, and then you guys are done. Okay. One more foot.
I'm also going to take my plastic tube here and put some sterile lube on it. Next, we are going to insert stop touching it. Nothing's even happening. Now that the tube is placed, we're going to place the cotton tip right in the middle. Preparation of our vaginal cytology. We're going to take our swab that we took and a microscope slide and roll it, not run it across the slide. Here in the middle to make sure we get a good sample. And then we are going to stain it in our Diff Quick slates. And once again, these are going to be 15 dips into each stain. Then we're going to take it out and rinse it very lightly. blot it dry. And now it is ready to be evaluated under the microscope. Now, as we are reviewing the slide of the vaginal cytology, I'm going to up my condenser so there's more light coming through it, change it through the fine and the tuner, and scan through the slide. We're at 40x right now, which is what we should be viewing the slide at. And all I'm seeing is a lot of non-fortified squamous epithelial cells, a few neutrophils, but no erythrocytes. So I'm going to say that this dog is an anestrus. During early proestrus, you're going to see a lot of erythrocytes with some basal and parabasal cells. As proestrus continues, you will start to see those number of erythrocytes decrease, and you'll see the epithelial cells show signs of cornification. By late proestrus, it will be all epithelial cells almost, with pynotic nuclei. During estrus, you will see a lot of squamous epithelial cells that are all cornified and anucleate. There will be no neutrophils and a small number of erythrocytes. In metaestrus, all of your cornified squamous epithelial cells will become non-cornified, and there will be a lot of cytological debris. When preparing for the skin scraping, we're going to take both a microscope slide and a surgical blade and place a drop of mineral oil on them to help the transfer and make it go a little easier. As well as a drop in the middle of our slide here. And today I'm going to show you how to perform a skin scraping. First, we're going to take a scalpel blade and run it over the point of the lesion a few times, straight across perpendicular to the skin. You want to make sure you get enough epithelial cells, so usually once you see blood start to form is when you will stop. And then you want the epithelial cells to place on a slide. We put a little bit of mineral oil to help get all of those epithelial cells on there. For the preparation of our skin scraping, we're going to take the slide that has the mineral oil and the epithelial cells that we scraped on it, and using the compression technique, I'm going to take another slide, place it right in the middle with that, and quickly slide it across.
Is this way or this way? This is kind of like scratch.
For our mite slide, I will place a glass slipcover over the slide and look at it on our microscope under 10x, which will be the 100 power with the I will scan through the slide. And I see no evidence of any Demodex mites, but I see red blood cells, which means I did get deep enough, as well as the base of the hair follicles. So there's deep enough and there's no Demodex mites. Today I'm going to show you how to do cross-match agglutination testing. So I've already gotten blood from my recipient and my donor in both purple tops and red tops tubes, and centrifuged both of them so that I got my plasma and my serum off. So I'm going to take my serum and put it in plain red top tubes, and this is going to be my recipient. This is going to be my recipient here, Titan. So I will take my serum off the top of here and place it in a plain red top tube. And I'll do the same with my donor slums. Now I'm going to get my plasma and decant it off of my centrifuged purple topped EDTA tubes. You may have to take a little bit of the top layer of blood to get all of that off of there. And I will do the same with both the recipient and the donor. Now I'm going to take 1 to 2 drops of each of these and place them in a glass test tube.
That's you, Jake.
And this is going to be my donors that we'll do first.
Oh, and I also took the liberty of giving her a 10-pound next time because we are.
And my recipients.
And if she gives it within a week. You want to go show her and tell her this test is on negative.
Now I'm going to fill the rest of the test tube with saline or 9% sodium chloride, 0.9% sodium chloride, such as we have here. Now I'm going to gently mix these. And I'm going to centrifuge them for 1 minute at 3,400 RPMs in our centrifuge here. Now that that is finished spinning, we're going to take them out. And we're going to decant off the sodium chloride on this.
Oh, wait a minute.
Now I'm going to add more saline into these and repeat this procedure twice. Now I'm going to make a 2% erythrocyte suspension by getting 0.02 mils of the packed wash erythrocytes that we just made and 0.98 mils of saline in a clean test tube. I've got my 0.2 in here. I'm going to place it into the test tube here. So I've got the 0.2 mils of packed lymphocytes in this one that I'm going to add
for the first couple of days it was
0.98 mils of saline or 0.9% sodium chloride into this solution for my final
and
2% erythrocyte solution.
he loved it.
I've also drawn out 0.2 of our other
You're not allowed to stop touching his hand.
packed erythrocytes because we have to do both. So I'll put that in the test tube.
Do you need help, Dad?
With another 0.98 mils of saline in that one. I'm going to gently mix those for our final washes. We've got both our donor and our recipient final washes here. And this is our erythrocyte solution. So after those are mixed, going to put 0.2. I'm going to put 2 drops of our recipient's solution into our major crossmatch and into one of our controls, our control for our recipient. And then I'm going to put 2 drops of the donor's serum into our major crossmatch. For our minor crossmatch, I'm going to do 2 drops of our donor's erythrocyte solution and 2 drops of the recipient's serum. For the controls, for the recipient, I put 2 drops of their erythrocyte solution in the control for them, and I will add 2 drops of the recipient's serum in with that. For the donor's control, I'll do the same. I'll add 2 drops of the donor's erythrocyte solution and 2 drops of the donor's serum. Now I'm going to gently mix those. I'm going to allow those to sit for 30 minutes and incubate at room temperature. Now that the tubes have incubated for 30 minutes at room temperature, we're going to place them back in the centrifuge to spin for 1 minute at 3,400 RPMs. I'm going to do both my controls and my major and minor crossmatch. Now that they've spun, I'm going to look for agglutination and hemolysis in the plasma. My control should have no hemolysis. And we'll tap this.
Did you give it a general estimate?
It was all together.
As well as I'm going to put some on the microscope and look at it under the microscope to see for any agglutination. This is my major crossmatch. I see no agglutination or hemolysis.
Start checking.
And on my minor crossmatch, there's slight hemolysis in that. Now I'm going to take a drop of each and place them on a slide to look at under the microscope.
You want to check and make sure we didn't do any in-house stuff, and then check the pills up front, see if we did anything else.
Now I'm going to look at both of my slides under the microscope to look for agglutination under there. I'm looking for grape-like clusters. There was slight hemolysis in one of the tubes, as you saw, but there was no agglutination on either of the slides, and so these two are a match for crossmatch.